Welcome to the Over 40 Alpha Podcast with your host, Funk Roberts.
We are live, and welcome to the Over 40 Alpha Podcast. This is episode number 129. I'm your host, Funk Roberts, former professional athlete turned online fitness coach, expert, guru, whatever you want to call it, specifically for men over 40, 50, 60, 70, and beyond, helping men completely transform their bodies, their lives, and their health through the pillars, right? Mindset, workouts, nutrition, recovery, sleep, supplementation, and overall health, and naturally increasing your testosterone levels. And today we are going to talk to Dr. Mitchell Cleonski, who is a neuropsychologist and the author of Dementia Prevention. And we're going to talk dementia. We're going to talk dementia because, I've always say this, as men, as we get older, right? As we get older, 40s, 50s, 60s, 70s, 80s, 90s, we naturally become the patriarch of our families. What does that mean? Well, that means that if anything goes wrong, if someone dies suddenly, if someone gets Alzheimer's or dementia, or someone has an accident in the family, as we get older, we're the ones that people look to keep everything calm through the chaos. And in order for us to do that, not only do we have to educate ourselves, not only do we have to live the, as I call it, the over 40 alpha lifestyle, which is be as healthy as we can, we need to be mentally prepared. And being mentally prepared means being physically prepared, being emotionally prepared, and being ready for the things that will happen as we get older, whether we want them to or not. And in our family, dementia has reared its ugly head. And it came very, very suddenly, and it has become extremely rapid. We've seen a rapid decline in Uncle D, and the family has come to his aid in quite a valiant way, for sure. Seeing everybody come together and work hard, the brothers and sisters and everyone, the nieces and nephews, everybody's coming together to help with this process, because when someone in your family has dementia, not only do you have to deal with the fact that they may not be remembering things, their memory, their cognition, all of those things decline rapidly. Physically, they may be declining depending on how it happens, and maybe not being able to take care of themselves. So, there's a lot of things that have to happen, moving in and out of places, moving them to home care, maybe having to go to hospital because it falls. Like, so much happens, but it happens rapidly. You still have a job, you still work, you still have family, kids, these people to take care of, and now you have to tend to this person. And most times you don't even understand what's happening. So the frustration of not even knowing really what dementia is, or across the board, because dementia is the parent. There's a lot of things underneath dementia, like Alzheimer's and vascular dementia and other things, that when you don't understand what's going on, and sometimes you're at the mercy of whatever doctor or physician is seeing your family member or your loved one, sometimes you may make the wrong decisions based on the fact that they may be telling you something that's different, or you're just frustrated because you don't know what's happening. So understanding dementia, understanding the causes, understanding how to prevent is so important, not just for the family members, but for us as we get older. Because if we live a lifestyle that's not congruent with preventing cognitive decline, we're in trouble. And our family has to deal with us when we're supposed to be the provider, the protectors, the procreators. We don't generally want to be that person that everyone has to take care of early in our lives. So today we have Dr. Mitch Cleonski, who's going to talk about dementia prevention. How do we prevent it? but we have to understand what it is. And again, it's in my family right now, but I've also, working in aphasia when I was younger in neurology, aphasia, apraxia, dementia came down the line quite a bit. Having to understand what that is. And I know how devastating it can be. And this was a stark reminder, but it starts with prevention. How do we prevent that happening from us? And then also, when we have an understanding, we live that prevention. We actually are actively living a healthy lifestyle. We can also start to help the others around us live that same lifestyle or something similar. So today we have Mitch Cleonski, who's going to talk about things that lead to dementia, what dementia is, and one of the biggest things that we have to deal with and understand that we need to be on top of is our nutrition, right? Nutrition is key. You can't outtrain a bad diet. That's what my shirt says right now. You can't outtrain a bad diet because you can't outtrain a bad diet. And so that's why in our 40s, 50s, 60s, and 70s, unfortunately, the diet plans out there or the way we used to eat, that just doesn't work anymore. Not for us guys, because we have physiological changes that happen to us after the age of 30. Our testosterone levels naturally decrease 1% to 2% every year. So by the time we get to 40, man, most guys' testosterone levels are decreasing across the board, but most guys' T levels by the time you reach 40 or 50 or 60 are super low. On top of that, our hormones are generally out of whack, right? Estrogen levels are super high. Cortisol levels are super high. Along that line, we suffer from sarcopenia, which is a natural loss of muscle due to aging. Muscle is super important. And when we lose muscle, we lose that metabolic health along with all of the other things that come with having no strength or no muscle. And then our metabolism slows down. Obesity is huge right now. And the metabolism is not generally because of our age, but more about the lifestyle. So when all of this happens, when we reach 40 or 50 or 60, we realize, man, I got to do something. We jump to diets out there, all of the keto and paleo and low carb, low fat, all these things, but they don't work for us because they don't take into account exactly what I just talked about, the physiological and the hormonal changes that happen to us and the lifestyle changes. That's why I created this book, Nutrition for Men Over 40, which I can send this specific physical book to you for free. All you have to do is just pay the little shipping fee that's with it, because I already paid my publisher to print a ton of these books. Well, actually now there's not a ton left. You go to over40meals.com, over40meals.com. If you're in the US, you'll click the US button and I can ship this to your door along with you getting the digital version and the audiobook version so you can start listening or reading it right now. Plus I got a bunch of freebies. But if you live internationally, I can send you for a very small fee, the digital version, the audiobook version, and all of the amazing bonuses that come with this Nutrition for Men Over 40, which is based on my Metatest Boost nutrition system that will help you, that has helped thousands and thousands of men. This isn't something that I just thought up of and just started doing. This is based on research, based on science, and most importantly, well, aside from me using it when I was in my 40s, thousands and thousands of men who are in my Over 40 Alpha Brotherhood program, which if you go to that proof page, over40alpha.com/proof, and you scroll, you'll be scrolling for like 30 minutes, looking at all of the before and afters, reading all the testimonials, because of this nutrition system, the easy, sustainable system that you get at over40meals.com. I want to ship this to your door. Listen, I'm giving you everything. I'm giving you literally a meal plan right here. Eat this at this time, eat this at that time. And if you don't want, if you don't like the foods, then you can, there's a list you can customize. Oh, I'm going to eat this food, eat that food. I tell you the foods to stay away from. I give you all of the information to help you plan your meals and to help you stay consistent and make this a lifestyle that thousands of men are still to this day using, because there's no other nutrition system out there that's geared towards men in their 40s, 50s, 60s, 70s. Believe me, it ain't out there. So go to over40meals.com. Pick whether you're US or whether you're in international. Even if you're in the US and you just want the digital audiobook version, it's super cheap. It's under like $5 or something, or maybe it's a little bit more. But anyway, listen, go there, grab the information, grab the audiobook, get the physical book sent to you because it's got the function on it. It's a physical book. Read it, touch it. People are tactile. And this will change your life 100% because you can't outtrain a bad diet. And as we get older, we can't eat the same foods we used to. We can't, we can't do the things that we used to because it doesn't work. So grab that and then come back because I don't want you to forget. And let's talk to Dr. Mitchell Cleonski and learn more about dementia prevention. Enjoy the podcast. Welcome, everyone, to the Over 40 Alpha podcast. I'm really excited today because on today's show and episode, we have Dr. Mitch Cleonski, who is going to talk about dementia and dementia prevention. Listen, this is close to home for me in two ways. First, I used to, for some of you guys who know, I used to work in neurology with people who had aphasia, but also that kind of coincided with apraxia and dementia and a whole bunch of other things. But now my uncle has dementia and his descent has been unbelievably rapid. So today I'm excited to have you, Dr. Mitchell Cleonski, on board to talk about dementia, what it is, and the prevention. So thank you so much for being here.
My pleasure. Sorry to hear about your uncle. That's tough dealing with.
Yes, it is. I'm seeing it in the family. Just literally last year at this time, it was totally different. We were talking. He was joking around. He had it was Uncle David, and to the descent throughout the year, and forgetting things, and like I know what to expect when it comes to dementia because I've seen it when I worked years ago. But the family, it's very difficult for them to understand why he doesn't want to do this, why he can't do this, can't remember this, can't remember that. And now it's to the point where we just put him into a home because he can't even take care of himself. So, yeah, it's incredible. But first, let's talk about how you got to where you are today. I know that you've been a doctor for 30 years plus, but can you give us kind of like a highlight of how you got here today?
Mostly through misadventure, I will tell you.
For sure.
So I've got a PhD in clinical psychology from a place in the Midwest, Bowling Green, Ohio. And I got this back in 1977. So it's been a very long time. I came out east. I moved to Springfield, Massachusetts with the intention of staying for a year because I was originally from Pennsylvania. I thought I'd go someplace else, maybe back to California. And that was 45 years ago. So you always wonder what your intentions, how they'll play out in life. Sometimes plans go differently than you expect. But I had had the good fortune of learning about neuropsychology back in graduate school at its very infancy. So back then, we didn't know very much about it. We were using neuropsychological tests, which are measures of attention, measures of processing, problem solving, short-term memory, as well as emotional state, intelligence, things like that, to get an idea of what's going on inside people's brains. So this was back before we had CAT scans or MRIs. And much of neuropsychology was aimed at telling us where the problem existed in the brain, what areas it was involved in, and from that, what was the likely cause of this. Things have progressed a great deal over that time. We learned a lot more about these functional associations, but also we now have much better physical tests. So you don't come to me to figure out really where the problem is, but more likely what kind of a problem it is. Is this normal cognition for this person's age? Because we're comparing this person's test scores with people like them, similar age, education, occupational background, rather than perfection, which is what a lot of us will compare ourselves to. And then we want, is this normal for their age? If not, where are the areas of strengths and weakness? More importantly, what does this mean? And then what can we do to stop this from getting worse? And can we make it better? And that's really the critical issue and where I've really directed my practice. I've had a very large practice. I've had the luxury of being in an area that there haven't been a whole lot of other neuropsychologists. So I pretty much in Western Massachusetts see as many people as I could possibly squeeze in. And I see about 1,000 new patients every year, which is sort of a Guinness Book of Records kind of thing in and of itself. I've had the help of several postdoctoral residents and several associates who I've employed in my practice. But we typically look at dementias, which include Alzheimer's disease, but are more than Alzheimer's disease. Many people don't know this, but the broad field of dementias is sort of like the field of automobiles. In automobiles, you can have Chryslers and Plymouths, and you can have Cadillacs and Toyotas, all kinds of different cars. Well, in the field of dementia, you can have Alzheimer's disease, vascular dementia, which is tremendously underrepresented, but is present in a lot of cases. There's dementias that come from Parkinson's disease, dementias that come from alcohol and drug abuse, dementias that come from hitting your head too many times, what we now call chronic traumatic encephalopathy. It's what we're concerned about with football players and rugby players and hockey and soccer players. So there's a whole lot of, that's just some of it. There's many more than that. But what I've really been looking at is how we can make a difference by changing the trajectory, catching people early, and giving them advice on lifestyle and medical areas that are going to change whether they become demented or they don't. Unfortunately, I'm also married to a brilliant physician whose name is Emily Cleonski, and she's taught me a lot about life and particularly a lot about medicine over time because she works in internal medicine and in psychiatry, but primarily in the areas of dementia. So it's a marriage of several things, love as well as professional interest. So we see an awful lot of these folks and try to help them every year.
Wow, that's amazing. And I did see some things that you've worked with the NFL. So like working with so many people on a, well, so there's two things. Number one, the fact that you're seeing 1,000 new people every year has some concern for me specifically, because that means there's a lot of people coming in needing your help, and not heeding to lifestyle or whatever, tips and strategies that you have to help prevent this, depending on what level they're at. But the second thing is the fact that you have so much experience, because I'm very key. Yes, the science and the research and all that stuff is great, but there's nothing like the experience of seeing so many different people with so many different uh, you know types of dementia along the spectrum, and being, just having that knowledge is incredible. So I'm excited to go on with this conversation. But let's back up and talk about what actually is dementia. So for a lot of people listening, they don't really know what is dementia.
Right, because I'm glad you focused on that. Dementia is a progressive neurological disease. So it's a change in how our brains are structured and how they function. And we look at both the external parts of our brain, the surface of the brain, the cortex, as well as the underlying or subcortical connections. And changes in how our brain is structured at a microscopic level, and meaning a cellular level, and at a chemical level. Most people don't understand that nerve cells don't communicate between each other electrically. They don't touch. They have to communicate chemically by sending out chemical signals on one end and taking them up on the other end. And so all of this incredible kind of machinery that's in our brain, these billions of neurons and billions of connections between them, is governed by many of the chemicals that our brains normally are involved in expressing or sending out and how they're taken up on the other end. So when those things go awry, when there's a problem, oftentimes caused by other medical conditions or by injury, things don't work properly, and that sets us up for a decline as we get older. So these chickens don't come home to roost oftentimes until our 60s, 70s, or 80s at a progressive level. So the stuff you do in midlife, the stuff you do in your 40s, really is important for what you're going to be like in your 70s. And so we're trying to reach a younger population than even those people would ever come in to see me for this problem, because they're not recognizing, their body isn't yet recognizing that how they're living their lives and what they're not doing and what they are doing is going to have an effect later on.
Yeah, well, because my uncle D is like in his 60s, so like late, I believe late 60s, or Yeah, I think it's late 60s to tell you the truth. It has to be late 60s. And so seeing this, and he's a very smart man. He was a teacher, and like so it was really weird. But thinking about all of the things that the factors that lead to dementia, it kind of makes sense. Um, how many people like how many people get dementia? Like out of three people or five people or what have you, what is the chances of people getting dementia? Men. Let's talk about men. Let's talk about men getting dementia if you can.
Okay. Well, men are a little less likely to get dementia than women because women live longer than men. So if you look at just the raw numbers of the population, women outnumber men in that field, but just because they're living longer. When you look at the gross numbers, I mean, if you're in your 60s, you have about a 10% chance of developing dementia. In your mid 70s, that doubles. You now have a 20% chance. And if you make it to your mid 80s, then your risk goes up to about 40%. Now, there are people who we consider to be super agers, people who are in their 80s but are still thinking like they're in their 50s. And those people seem to escape a lot of this. But for most people in their mid 80s, there is some decline, and about 40% of them have enough of a decline that we say this is not normal. This is more than what we call mild cognitive impairment, which is sort of a gateway toward dementia. Say they're worse than this. They're not just forgetting things occasionally. They're not just having, quote, normal word finding problems under stress or when they're busy or when they've exercised, they're out of breath, but rather this is more of a functional decline. So they have a diagnosis of dementia. The gross numbers are that the United States currently, there's about 6.5 million people who have Alzheimer's type of dementia, but that's an underestimate because it's not considering the other types. So it's probably about 10 to 11 million Americans who are currently experiencing this. And for every one of those, there's another person or two who's taking care of them. So it's really a
Right.
far-reaching kind of problem.
Yeah, because this, what's happening with my uncle is that now everyone has to take care of him, right? Like it's like, and it happened so quickly. It happened within 2 months from I think he had a fall, which put him in the hospital. And from that moment, he lives like 2 hours away from us. So, my wife goes out, his sister, his brother, and then we had to clear out the house and like so much was happening. So there's physical as well as cognitive decline that was happening all at the same time. So you're like the time, you're right, the time of the family to have to tend to this very quickly because it deteriorates very quickly.
So let me step out of my role as podcast guest for a second and
Sure.
step into my role as sort of distant clinician
Yeah.
consultant. Talk about your uncle. So he's in the late 60s. I don't know what his health risks are, whether he's diabetic or hypertensive. If he's African American, there's a good chance he is one or both of those because the odds are much greater just genetically and environmentally that he's got that. It's one of the other disadvantages of minority status in this country is you have a twice as great a chance if you're black or brown of
Yeah.
having cognitive impairment or dementia.
He is Caucasian though, so just to let you know.
Oh, he is? Okay.
Yeah, I call him Uncle David, but because it's my wife's uncle, but it's like he's Uncle David. Like I used to call him all the time. It's like he's Uncle
Okay.
David.
So he doesn't have that particular risk. Okay.
Yes, yeah.
So the question is, did this fall? Say, if somebody has some mild cognitive problems,
Mm,
any kind of physical trauma, whether it's an illness or like pneumonia, or a trauma like a fracture or something, can cause a more rapid deterioration
mm,
of their mental status, of their thinking abilities. But the other question is, if he fell and hit his head, did he get a CAT scan at the hospital?
mm,
And if so, did they follow it up a couple of months later to make sure there wasn't a slow bleed inside his brain?
mm.
Because the course that you're talking about, the rapidness of that is really not typical for dementia. So
Right.
you start
So
to look at what else could it be along the way that could be
100%.
going on here.
There was
And
a there
hopefully,
was a there was a fall that we still don't know, but that was the catalyst, I believe. That fall that happened earlier, he's got a couple of falls. The one that put him in the hospital because he tried to go out on his own for the last time. But the fall, I think that happened early in the summer. That really accelerated everything, but I think things were happening before that, and that could be lifestyle factors as well. But it accelerated after the fall, but we don't know exactly. But the doctors did, because they're the ones that said, "Oh no, he's got dementia," and this is
Yeah.
it's yeah.
It may be the diagnosis or maybe something else. I'm telling
Yeah,
you, when you see as many people as I do, you get a lot of medical reports, and some of them are really in depth.
right.
Others are very cursory.
Yeah.
And so there are a number of times when I'm sending people back and saying, I want a more in-depth evaluation
hmm
because this doesn't make sense to me. And I believe in turning over all the stones. You really want to understand what's going on.
100%. I think the problem is that when the family or of anybody doesn't really know about dementia, wasn't expecting it,
Right.
really don't know, they're just going by whatever the doctor who saw, him at the time is saying. And it's funny you just said that, because I just had someone else on that podcast who had prostate cancer, but the way he's going at it is not just whatever this doctor says and whatever this doctor says, really digging in and doing more research and getting second and third and fourth, that sort of making sure every stone is unturned with
Right.
CAT scans and so and so. So I believe that that's the way we need to think about things moving forward when we get diagnosed with whatever it is, or someone in our family does as well, not just taking it the first doctor at face value.
Which is why, as you'll see over my shoulder, we wrote a book called
Yes.
Dementia Prevention. And the idea here is to empower people to do things proactively. So there's a questionnaire in there that you can get for free at our website. You don't even have to buy the book to get the questionnaire. It's the Dementia Prevention Checklist. And the
Right.
website is called braindoc.com. And
Right.
so you can download this and fill it out, and it'll tell you where you're on goal, where you're off target, or where you're close to target. The areas that, I could tune that up a little bit to get myself in a safe place. But understanding where you are and understanding what this condition is all about is a real important first step to then saying, where can I intervene? What medically or behaviorally can I do to reduce my risk? Because the statistic is 1 out of 2 cases of dementia are preventable.
Okay. So,
Let
okay.
me say that again. 1 out of 2, 40 to 60%, large scale studies, major groups have concluded just in the last 5 years that 40 to 60%, 1 out of 2 people can prevent themselves from having this. That's a
Okay.
huge number.
Yeah, it's massive. So prevent meaning like just never getting anything, like never getting the symptoms
Right.
of or the, like, obviously some symptoms will cross over depending on what you have, but okay, so 1 out of 2. That's massive actually. Um so what are some of the symptoms? Because aside from that fall or what have you, what are some symptoms that people can start to look in themselves as they're getting older, but around them too? Because one of the things that I preach is that we are, provide, protect, procreate, but we're also the patriarchs of our family as we get older, whether we want to be or not. Like, whether we want to be or not, as we get older, if someone in the family, something happens, they're always going to look to dad or grandpa or what have you. So we need to also be aware of what are some of the symptoms that we should be looking for.
Well, it's a great question. Unfortunately, many of the symptoms between early concern and normal thinking cross over each other. And that's
Right.
what makes the symptom approach difficult. So most people come in, I say to them, so what brought you here? And they'll tell me, well, I'm having more difficulty finding words. And that could be a symptom. On the other hand, sometimes it's a symptom of stress. Or they'll say, I'm putting down my coffee cup or my keys and I can't remember where they are.
Mm.
Well, that can also be a symptom of anxiety, depression, forgetfulness, ADHD, or dementia starting. When you start getting really into it, you're finding out they're saying, well, I used to be able to balance my checkbook, and now I'm struggling to do that. That's of concern. I used to know how to get from here to there because I've been there multiple times, and now I'm starting to get lost.
Mhm.
That's a real concern. People are telling me I'm repeating myself, and that's just not a stylistic thing. I know people who tell you the same story 3 times just because they like telling you the story. These are people who I just didn't remember that I told you this story before, And usually their spouse or friend is with them and is saying, we've heard this story a couple times today, but they don't remember it at all. So those are the people, but they're also maybe not having an awareness of this. That's the other tough part. There is this phenomenon in dementia where you may be the last to know. It's like having a blind spot in your rearview mirror. There's something there, you just can't see it.
Right.
They have a technical term for this. It's called anosognosia, which is Greek for meaning the inability to see oneself, to appreciate oneself.
Ooh, wow. Okay.
And so that's really tough, because then you get into these situations where a person is really declining, sees nothing wrong with themselves at all, more so than just normally being a guy, being perfect. Yeah. So they really can't see anything wrong with themselves. Cool. And other people are saying, but we got to do this for you. We got to help you with this. We got to take over this decision. And you can't drive a car. And they're getting really irate because, you tell me I can't drive. And as your listeners, all the men out there know, our keys are attached to our testicles. So don't mess with my keys.
Yeah, exactly. Exactly.
But they'll tell me, oh, I've been a truck driver. I've driven 1 million safe miles. And I said to them, okay, fine. I agree with that. And I know you've been a good driver in the past. But if you woke up this morning and you were blind, would you get behind the wheel of a car? Of course not. I never do that. I say, okay, this is like being brain blind. You can't see the problems you're having, and you're remembering what you used to be like, in the same way that a blind person can remember what they used to be like before they lost their vision. But it doesn't make you a good driver today. It means you were a great driver then. Right. So there's a lot of those kind of changes that you have to deal with. Yeah, but if anyone has a suspicion, I think what they really need to do is their doctor needs to give them a quick test in the office to get an objective measure. Just the same if you were concerned, if you went to your doctor's office and they say to you, well, how's your blood pressure? You'd say, well, doc, why don't you take my blood pressure?
Yeah.
Exactly. How's your weight? Well, let's step on the scale.
Yeah.
Let's measure this stuff.
So what tests would you go to ask for? Like if you're going to see your GP, what tests could you ask them to do?
They all have or should have a go-to kind of screening test for this. Okay. For a number of years, it was something called the Folstein Mini Metal State Exam. More recently, there's one called the Mini-Cog. There's another one called the MOCA. We actually developed our own test, which was used by a bunch of doctors, called the MOST, the Memory Orientation Screening Test, which is now not currently available. We're going to be rolling it out again, probably with the home version as well, because we want people to be able to help out a family member by using an online test to see what's going on with them before they go to the doctor. That's really where I think our intervention is going to be focused in the future. But something that's objective. It won't be perfect. It'll be brief because it has to fit into what is oftentimes way too quick an evaluation. Right. The doctor's visits keep getting shorter and shorter, even though our problems keep getting more and more complex, bigger and bigger.
Yeah, for sure. Wow. Okay, so that's really good. I think the home, that first stage is really good because it forces people who are going to be taking that test or administering it with somebody the ability to have to actually learn about dementia and start to do some digging and getting more knowledge and being open to speaking to specialists and doctors, etc. So let's talk about some of the causes, like how much does genetics play in dementia? Like if I have family members who get dementia all the time, or it's through my roots, generations, how much does that play?
It plays, for most people, a relatively small part.
Okay.
There are exceptions to that. There are certain types of dementias in certain family clusters that are early onset. We're talking about everyone in the family in their 50s has dementia. But fortunately, that's the vast minority of people. And then people say, well, I've got a mother who had it and a grandmother who had it. I said, okay, fine. How many siblings did they have? Oh, my mom was one of 6. How many of them got dementia? Well, none. Okay. Well, now your odds are actually less than the normal population
Right,
because they
right,
all live to be in their 80s. So only 1 out of 6 got it. You would expect if 40% get it, that 2 to 3 would have had it. So that's not such bad odds.
right.
There's more genetic tests that they're doing these days, although I really don't steer people very much to getting genetic tests because at this point, I don't think they have anything of value in terms of what you're going to do about it except worry.
Right.
So if you go and they say, well, you've got, heavy genetic loading, what should I do? Exactly the same things that you should do if you have no genetic loading in terms of taking care of yourself and avoiding the things you should avoid and doing the things you should do. All that's going to tell you is I'm now going to interpret every time I forget someone's name, oh my God, the end is near. This is it. My brain is going. I don't want you to do that. That's a terrible way to live.
Yeah. And that's also probably accelerating your chance of getting dementia because of the stress and
Potentially,
anxiety and the
yeah.
cortisol, I'm sure, maybe. Are there, so, with testosterone, you have that natural decline, 1 to 2% every year, or sarcopenia starts to happen after 35. Is dementia kind of like, is there like like no matter what? I know you did mention that, but I just want to get it clear that no matter what, whether you are super, super, super healthy and you do all of the things that you're supposed to do in regards to prevention, or if you're completely unhealthy and you drink alcohol and you do all those things, it doesn't matter. Like, is it still like 10% no matter what, 20%?
No,
Okay.
it still matters. It still matters. Now, you will always find some people who take terrible care of themselves. Some portion of those people will live to be 90
I
and
know.
clear-headed the whole way. Everyone's got an uncle who smoked 3 packs of cigarettes a day and ate only junk food. It was fine. And I see other people all the time who come in and we go through their list of risk factors and they take excellent care of themselves. They've got great educational backgrounds because education is protective. So if you're raising a kid, make sure that kid stays in school as far as they can go. You don't want to allow them to drop out because they're upset in the moment. Education is one of the moderators of future dementia risk. But if you're exercising vigorously every day or enough times per week, you're eating a good diet, you're taking vitamins as you should, you're managing all of your medical problems, you're not smoking, you're not drinking excessively, you can still get dementia.
Right. Okay.
The fickle finger of fate can point your way. And what we talk about in the book is it's sort of like doing fire prevention. You may do everything to fireproof your house, and there could still be a wildfire that comes through and destroys the house. There's no way of fully guaranteeing it. But if I can reduce my risk by half, what's that worth? I think it's worth a lot. I certainly think it's worth the time and the investment that you're going to make in figuring out what your weaknesses are and addressing them. Because that's going to, first of all, it's going to you're going to have a healthier overall life anyway, just by
Right.
doing those things, as you well know.
Yeah, that's what I was going to say. The byproduct is going to be across the board when it comes to health and other things as well. I just want to touch on that education for a minute. And this is because I'm 55 years old and I go to Harvard. So I started Harvard last semester or 2 semesters ago. And I'm doing a master's in business innovation and entrepreneurship. And is that helping me?
Yes,
The
yes.
fact that I'm showing up every week and we got the 2 hour lectures and then have to read freaking books and then do the summary of the book and hand it like
You
that.
are creating new neural networks.
Beautiful.
That's what I tell my wife, who's 2 years younger than me at 71, is writing a book caused us to have to learn so much and put it together that is creating new neural networks. Now, I don't regard that as a good idea for a marriage, but if you can survive it, it's wonderful.
Wow, that's great. I
But
hear
good
you.
for you. Are you up here in the New Because I don't even know where you're from.
No, I'm in Toronto, and we do. It's also the Harvard Extension School, and it's my master's is 4 semesters. I have to do 4 semesters in 3 years, and it's literally 5 months each semester, and every day, depending on the the class, but what I take is every week, 2 hour live, and then obviously homework and stuff. So yeah, it was the very first semester was very challenging. I was not expecting the workload, not even from when I was in school when I was younger. So I was like, oh geez, guys, like we're reading books every week. Come on. And then you remember, oh yeah, this is Harvard. It's a whole different, a different story here.
Good for you. That's excellent.
Yeah, it's
And
good.
it does continuing learning and continuing working. I'm not a big fan of retirement unless somebody has a lot of hobbies and interests, because you don't want to retire from life. You just want to retire from a job that you no longer want to do. And there's a real lack of retirement planning from a mental point of view. There's a lot of retirement planning financially, which is really important, but it doesn't then tell you what you're going to do after you don't have to work financially. So I see people all the time and they're sort of like, I said, what do you do? They say, I putter around. I say, define that for me, because I don't know what puttering
Yeah,
means.
exactly.
And they have a hard time because, well, I do things my wife asks me to do, and I drop the grandkids off at the bus stop, and I go visit a friend for breakfast once a week. I say, wow, that doesn't sound like nearly enough. They say, well, actually, it isn't, but I'm not sure, and I haven't really planned for it. So there's a real gap in our preparation for later life, considering
Yeah,
that most people are going to live these days to be in their 80s. And you
right.
have to say, okay, what do you do for the last 20 years?
Yeah, no, for sure. I mean, that's actually a massive problem in men's health and mental health, because what happens and what I've been seeing quite a bit is when for us men, we need purpose, right? And we've had purpose throughout our entire life until boom, okay, we're retired. Some of us, some men, not us, some men, their wives may be gone. So if that's the case, that's now I don't have that camaraderie with my loved one, but kids are
Mhm.
gone, of course. And depending on where grandchildren live, they are may not be accessible. Then most men, specifically that age, don't have a lot of friends, because our friends, if we haven't been making specific good, solid friendships over the our later part in our lives, which a lot of men don't do because
Yeah.
we're stuck, we're just right here in our own little bubble. There's no connection, there's no community, there's no bonding. Then when you retire, you not only do you not have purpose, but you don't have anything. And the increase in mental, I'm sure you know, is crazy. So like ensuring that we are preparing ourselves for a life of retirement is so important, so
Mhm.
important, so important. So let me just ask a question about dementia. And if you get dementia, you get it, right? Like there's no. Is there any reversing
Yes.
dementia? Okay,
Yeah. Well, the first thing is to figure out, is it dementia or is it something that looks like dementia? So that's number one. And so you're ruling out depression, you're ruling out some kind of infectious process, you're ruling out something growing in the brain, like a
mm,
tumor, you're ruling out abnormalities. Even in some of the blood tests that could be tested, you can have things that look like dementia, but are really something called hyperhomocysteemia.
that's a
Oh,
blood
you want
thing, right? Yeah,
hyperhomocysteine? What the hell is that?
yeah.
Hyperhomocysteine means there's an elevation in your homocysteine levels. And essentially, that and an elevation in methylmalonic acid will block vitamins B12 and B9, which may be perfectly fine in your bloodstream, from getting across your blood brain barrier into your brain. And if you have coronary artery disease, that increases the chances of this. Simple blood test will tell you if it happens, and there's actually a prescription vitamin that will lower your homocysteine levels down into the normal range. We see people who they've got 3 or 4 medications, all of which suppress their thinking levels because of something called the anticholinergic burden. So anticholinergic means it drives down a chemical in our brain called acetylcholine. Acetylcholine is a memory chemical. It's important to have enough acetylcholine. Well, what are those medicines? Well, if you pee too often, your doctor, your urologist may have given you a medication to stop you from doing that. It's pretty anticholinergic. You may be on a heart medicine that is anticholinergic as one of its side effects. You may be taking an over-the-counter sleeping pill, one of those things with a PM at the end of the name, that is anticholinergic. You may be taking something to dry up your sinuses. All of these things added up, which is one of the reasons why we link to a anticholinergic burden calculator in our book, so that you can go up online and check out anticholinergic, CHOLINERGIC, anticholinergic burden, and you can actually put in your medications and see what it tells you. And then you got to go talk to your doctor if it's high and say, are there alternatives? We have other medications for urinary control that are not centrally anticholinergic, won't affect your brain. Why am I needing to take this thing to help me to sleep at night? What's wrong with my sleep pattern? Do I have sleep apnea, an underdiagnosed condition where you're not breathing effectively while you're sleeping? So there's lots of things you can figure out that look like dementia, or at least the precursor, mild cognitive impairment. Fixing those can make a huge difference in what you look like and how you perform, especially the sleep apnea piece. There's a recent study looked at 6,000 people in research centers across the country, places where people go to be part of study groups that are followed every 5 years. The Framingham Heart Study is one of those very famous places. And what they found was, out of 6,000 people they recently recruited at 6 different places across the country here in the United States, 50% of the people tested had sleep apnea.
Wow.
50%. 50%. There was a study that was just published last week out of Taiwan, where they looked at about 1,700 people and found a startling 69% of those people tested one night overnight had at least mild sleep apnea. So if you have sleep apnea, like I do, I've been using a CPAP machine every night for the last 18 years.
Wow.
It means that when you're sleeping, you stop breathing, or your oxygen level declines by 4% at least 5 times every hour. So if not enough air is getting down your lungs, not enough oxygen gets drawn out, gets up to your brain, and your brain doesn't work properly.
Mm-hmm.
It doesn't flush out the normal toxins that develop over the course of thinking during the day. Something called the glymphatic system doesn't work properly, and it can't make effectively a chemical called adenosine triphosphate, otherwise known as ATP, which is an energy chemical. So you're tired all the time. You fall asleep while watching the game. You sit in your easy chair, and next thing you know, they're talking about, the old man is snoring.
Yes.
So all of those things are really important, and there's not a lot you can do unless you address oxygen. It is sort of the secret sauce for a lot of people.
Right.
If you treat that, lots of stuff becomes possible.
Right.
And so I really am a big fan. I'd like everybody at age 50 to get a home sleep study. One night in your own bed with a little gizmo on your finger or underneath here, up in your nose, and we'd be able to identify all these people who could benefit from this. By the way, for all the guys out there, guess what 50% of the men going to get the little blue pill at the urologist's office are suffering from?
Yeah.
Sleep apnea.
Really, eh? So, I think I did know that, actually. I didn't know that. Yeah, because that's
It's
right.
oxygen. If you are not getting enough oxygen out to the tips of all of your body parts, guess what ain't working?
Yeah, the old Johnson.
Exactly.
The old Johnson's not rising in the morning, or when you need them to rise at all. Yeah, I guess too. Not enough oxygen is not going to get that blood circulation going, right? Not going to get
We'll get those oxygen molecules
Yeah.
out to the very tips, including your brain cells.
Right. So those are so what you were talking about before were like things that look like dementia, but if you are diagnosed with dementia, like, okay, this is it, whatever level it is, can you reverse it?
occasionally.
Okay.
The one group, so we did a study, my wife and I. She was the real brains behind this study. We followed 700 people in our practice over 2 years, and we tested them every 6 months. The group that saw just me were referred in by doctors in the community. The group that saw her for their medical care, most of whom I also tested, but she was deriving their medical care, had what she calls an advanced protocol for care. And this advanced treatment protocol, she ran all the blood tests that most doctors don't run. Everybody in her group got a sleep study, and a great many of them ended up on CPAP to treat their sleep apnea. Both groups, almost all of the people got started on memory-sparing medications, which have been on the market since the 1990s. There are 4 of them that have been approved and effective since the 1990s. We encouraged all of them to exercise and to take better care of themselves. We worked on modifying their diabetes, their hypertension, et cetera, et cetera. So we followed them every 6 months for 2 years. Her group got a little bit better from point 1 to point 2, whereas the group that saw only me and had the regular traditional medical care were worse enough by that point that there was a significant difference between the two. 6 months after that, a year from inception, the gap widened because her group stayed the same. My group continued to get worse. And a year later, it was even a greater discrepancy. We presented this back in 2014 at the American Academy of Neurology meeting in Philadelphia. And to our belief, it's the first time that anyone's shown improvement in cognition by changing all these factors.
Wow.
The key ingredient for most people, when we really boil it down, is the combination of dementia medications that we've had out for all these years, usually a combination of 2 of them, and effectively treated sleep apnea. That's the subgroup that it has most of the effectiveness. And those people went up about 15% in their cognition from point 1 to point 2. And a year and a half later after that, we're the same. So yes, you can get somewhat better. No, we don't have possessed the magic to reverse everything. But even without that advanced protocol, if you're simply being treated with memory medications, your chances of slowing this down or stabilizing it are really, really good. So we're very good at stopping it from getting worse for long periods of time. We took a look at people 5 years later after we started seeing them, and those who stayed with us and stuck to their treatment regimen were almost entirely unchanged from when they started out.
Right. Okay. Wow. So that's good. That's good to know because you're prolonging a better life for everyone around, for the family to prepare and understand. And man, I wonder if so the sleep apnea and the dementia medication, I wonder if um the life like if no, I don't know how old these people were, but I'm wondering if like nutrition and workouts and or not even workouts because it's just movement at that point, more movement and some of those other things. Were they part of the your wife's side of things, or was it just those 2? And then some people did it and some people didn't.
In both groups, there was about an equal.
Okay.
The average age was about 72.
Okay.
The average level of entrance in terms of the dementia status, was mild dementia.
Okay. Okay.
So it's a group where people are aware enough, and there were people who were both better and worse. We had people with moderate dementia, a little bit worse, and we had people who had mild cognitive impairment, who had just slipped from their normal cognitive level. So it was a diverse group. We didn't control everything. We didn't do any special interventions in terms of lifestyle. We didn't run exercise groups or monitor that in any way.
Yeah.
So those are the variables. But those are things that I talk about all the time. Here's something else that's really important. Hearing loss. Turns out that even subtle hearing loss is a cause for dementia.
Ooh.
So Here's a story I always tell
It's
people.
interesting.
So this guy calls up his doctor and says, "Doc, I'm worried about my wife's hearing. She doesn't seem to hear me." So the doctor says, "Well, I could give her some tests, but here's a home test you can do. I want you to stay about 20 feet away from her when she's not looking at you and ask her what's for dinner. And if she doesn't respond, walk about 5 feet from there and ask her again. If she doesn't respond, get up to about 5 feet away from her and eventually until you're behind her. That'll tell you how her hearing is." So the guy does this test and he gets up right behind his wife and says, "Look, what's for dinner, honey?" And she turns around to him and says, "For the fourth time, we're having chicken."
So he's the one that had the
He's the one that had the hearing loss.
That's awesome. I love it. I love it. Well, yes, I love it. Okay, let's talk about maybe give me 5 lifestyle factors that lead to dementia, if you can.
Sure. Smoking cigarettes.
Okay.
Just don't. Quit. Do something to get rid of that habit. Drinking alcohol excessively.
Mm-hmm.
So what's excessively becomes the question. And there's debate about this. Generally, for men, I believe that 2 standard alcoholic beverages a day is probably not going to increase your risk tremendously. The research says that your brain doesn't look as good if you're drinking any alcohol at all.
Totally.
But the reality is if you're drinking, and what's a standard drink? Well, that's a shot of hard liquor, 4 ounces of wine, or 12 to 16 ounces of standard beer. I'm talking about standard beer, not the craft brew. That's twice the alcohol content. You have to figure that out as well. So that's the second one. Third one is obesity. People say, well, it's not a moral thing. I agree. You got to ask yourself the question is, what size was my body meant to handle? What am I structured to be? How much weight is a good weight for me in terms of energy, in terms of movement, in terms of health?
Yeah.
Sleep apnea, you got to get a sleep test. I really believe for most people, especially if they snore, especially if they're up more than once a night to go to the bathroom, because that's actually related. If they're falling asleep watching a game or reading a book, they should go and get tested for that. And the older we get, the more likely that is. And probably the fifth one would be control of chronic medical problems like diabetes and hypertension. If you're not taking your blood pressure pills because you don't feel like it, get over it. It's a silent killer, and it will reduce your risk of stroke and heart attack. And there's a reason why we measure blood pressure. It's really, really important, and it needs to be kept under control, and that should be a prime focus.
For sure. Yeah, that makes sense to me. I mean, alcohol, I always tell my guys, like, why there's no need to drink alcohol at a point of our lives. We're 40, 50, 60, 70, around that age that, we've been drinking when we were kids. We've had all those days. We're not missing anything. The social aspect of drinking is actually the social part of it, not the alcohol. And of course for these guys who are trying to increase their T levels naturally, trying to lose weight, burn fat, live a healthy lifestyle, just to me just doesn't fit in there. And I definitely agree with you on the smoking side of it. Obesity 100%. I mean, it's an epidemic. It's crazy that with so much advance in medication, medicine, and health and technology and all of these things, but I know it's more of a execution thing than anything, as opposed to like actually doing something.
Well,
Because
the new stuff is showing us that glucose control through some of these medications may be for a portion of the obese population much more important than habits.
Right.
And I was talking to one of my patients who had recently been started on Ozempic, one of the semaglutide medications.
Yeah.
And he said something that really struck home with me because it went against everything I sort of thought about in terms of habit. And he said to me, I'm 70 years old. In the past 3 weeks, I've been on this medication. I've lost about 6 pounds. He said, which is good, but I've lost 6 pounds before. He said, for the first time in my life, I felt full.
Right.
I said, what? He said, yeah, for the first time in my life, I didn't finish one meal and then start to think about what I should eat next.
Right.
That was astounding. And I've talked to other people since then, and they say, oh, yeah, since I started this, I have the same thing. And it's difficult to wrap your head around because my guess is you as well as I, we know what it's like. We've, holiday dinners and thought you're full. The idea of someone asking you, hey, would you like to eat some more of your favorite food? It's like, no way.
Yeah.
But not for people who have this particular condition.
Sure.
So those medications, I think, are going to be game changers and create this medical approach to weight control that could make a real difference for a lot of people.
Yeah, I think those medications are good to specifically to start a process. Because there's so many other things that we need to work on when it comes to health. Just weight loss isn't the only thing, but for if you are obese and now you're not feeling full, now we can start to work on other things like exercise and
Oh, yeah.
and eating, starting to whatever you're eating. When you're eating the right foods that'll help with hormones and metabolism and all of the other things. Building muscle is going to be very key, and then just just the lifestyle changes that will help you stay healthy throughout as you now are feeling better, because you're going to feel better about yourself because you're losing weight, you're feeling full, and you're like, wow, okay, maybe I can do a little bit more now. Let's start to pile on some other healthy things that we can do, because now I have that precursor, that little thing that went, oh man, okay, this isn't okay. This is it. This is now I can start to do other things that, with some confidence, right?
And it's really a great point you're making, that the kind of circle of, we talk about negative and positive kind of multiplication, where, people get into these vicious cycles where they are overweight, therefore they're not interested in anyone seeing them. They're
Right.
not interested in exercising. They're using food as a way of feeling better, which puts on more weight, which does, and then and you're saying, well, if we turn this around, then we start to go into a positive direction, and the other things flow from that. Exercise becomes easier and more
Yeah.
gratifying, and you can do it better. And
Right.
wow, that feels really great. And now you want to go out and do more things. And so
Yeah.
it really makes a difference.
Totally confidence. So many things can spark with that. So I agree with you. I think that medicine is going to be key when it becomes a little bit more affordable, and more people can access it, for sure, for sure.
Exactly.
We talked a little bit about stress, and I think you did cover it a little bit, because a lot of the times when you're stressed or have anxiety, what have you, a lot of that can look like dementia, right? All right. But if you are chronically stressed all the time, and no, and it's negative stress, because some people have a lot of stress, but they know how to, they know how to handle it. They know how to put it in specific buckets. Does that lead to dementia, or does that accelerate chances of dementia, or do we know about that?
No, it's a little harder to pin down. We know depression increases your risk. We know that also some of the ways people cope with depression, which is using anti-anxiety drugs, drinking too much alcohol, further increase your risk. Theoretically, the increase in cortisol levels due to chronic depression and stress is going to change your response to physiological changes that could lead to that. And people will then also have problems with all the other factors. So, yes, the question then becomes, again, that issue between what's a good balance of enough things going on that you stay active and interested,
Hmm.
versus too many things, or things which are seemingly out of your control.
Right.
Having a lot of responsibility and very little power is the killer part of stress.
Yeah.
If you have a lot of responsibility but a lot of power, you're probably going to manage it pretty well. If you have very little responsibility, having very little power doesn't matter too much.
Right.
So,
Exactly. You don't have a
but
lot.
for most people, it's that difference where they feel like they just got to be there for everybody and do everything, and they're not getting help and they're not getting support, and those are very stressful, or they can't get out of the situation.
Mm.
That really causes us to be in overdrive physiologically a lot of the time. So
Does
yeah,
low, yeah. Does low testosterone? Is there a correlation between having low testosterone and dementia?
Well, to be honest, low testosterone may actually be helpful because it's going to rebound. I know this doesn't
I did
sound like
not want
something
to
you want
hear
to
that.
hear.
I
But
did not want to hear that.
what protects women from
Oh,
dementia
women,
longer
right?
than
Yes,
men is
yes,
their hormones. So when they go
yes,
into menopause, they
yeah,
then become andronized like we are.
yeah.
So adding to that with more androgen may make us feel stronger and better, but it may not be so good for our brains in that sense. I
Right.
don't think there's enough research for me to give you a
No.
definitive answer, but that's off the top of my head where I'm going
Yeah.
with that.
Yeah. No, I agree. I hear what you're saying, and yeah, I'm going to definitely dive deeper into that because I believe that we need that testosterone for so many other reasons that
Yeah.
um, keeping it low. I mean, I see on a daily basis through all the guys that I work with because we have a membership of like 18,000 men. So we see a lot
Wow.
of people in our membership and they're posting, and a lot of them have when they come in, a lot of times the testosterone levels are low, and seeing them, just aside from the physical, the mental health issues that come with it, low energy, no confidence, just all those other things that come with low T. It's like that's the first thing we're going to tackle naturally is getting your T levels up and seeing.
Well, let me tell you a funny story.
Yeah.
This is a study that was just published like a couple days ago,
Okay.
and so they did this study where they had women crying, and they captured their tears. Okay, and then they had another thing that looked just like that. And by the way, that was odorless, but it had the pheromones in there. And they had another thing that was just saline, that was just salt water. And they had this experimental task where they did it with men. And in this experimental task, they did something which particularly frustrated the men. And the men were then supposed to sniff this thing, the little vial. They didn't know what was in it. And then they were allowed to deliver a fake punishment to someone in
Study.
this testing paradise study. Yeah. Well, it turns out that the men who smelled the tears of women who had cried had like a 40% lower anger response than the men who were doing the saline. So theoretically, it was actually interfering with their natural testosterone at that point.
Right.
So,
Well,
so
that
you got
makes
to
sense.
work with your guys when you boost their testosterone. Make sure that they also employ more empathy
Yeah, oh,
because
100%. Well,
it's going to be
that's part of
harder.
that's part of our Mindset Academy actually, because I also teach mindset, and empathy is massive part of
Good.
that because that's it's a stoic person needs to be empathetic. But it's funny you say that because as soon as those tears, like, oh, the tears come, it's like you're trying to break up with somebody and they start crying. It's like, okay, I'll stay with you for another. Okay, listen, all right, no problem, we'll stay together. It's like that. That is so funny. Well, you know what? Your book, Dementia Prevention. Where can people get that book?
Well, thank you for asking. They can get it in a bunch of places. You can get it from the publisher, Johns Hopkins Press. That being said, you're going to get it faster if you order it through Amazon. It's going to be the
Perfect.
same price. You can also get it as a download on Kindle. You can get it as a download on your iPad.
Mm,
You can also listen to it if you prefer to consume it because audiobooks
right.
has it. It's read by an actress named Nan McNamara, who is so good that when I'm listening to the sample of it when it first came out, I'm laughing at jokes that I wrote that I didn't find funny anymore. I was editing the book.
Yeah.
So she's really, really interesting. And I'd encourage people to listen if they like to do it while they're walking or they're riding or they're working out or whatever. You can learn something in many different ways. But the book is also at Barnes and Noble. It's at all kinds of local bookstores. It's
That's
also in
amazing.
the library. If you have a good library, you can also borrow this book.
People still go
So
to the library?
they do, they do,
Okay.
especially
Okay.
for audiobooks because you can do a lot of that distantly.
Oh, right. Okay. That makes sense. That makes
Yeah,
sense. And then braindoc.com is where we get the checklist.
you get the dementia prevention
Okay.
checklist. If you go under the tab that has media, you'll see a number of other podcasts. Not many as good as this, but
Oh,
you'll see other podcasts that that's true actually. This has been a great deal of fun. So that you'll see there if you want to get some other kinds of perspectives and information.
Sure.
But there's a lot of information we try to pack into it. But I'm really excited. We think this is a movement. This is that dementia prevention should be the next step in where we're going, rather than waiting for the disease to show up and then trying to figure out what to do about it.
Mm.
They talk about, every September is National Alzheimer's and Dementia Month.
Right.
I want to have August be Dementia Prevention Month because it'll make our job easier when we get to September.
Well, I'll tell you something. I created National Testosterone Awareness Day on November 17th. I did that. So you can do that too. You can create a day that's Dementia Prevention Awareness Day or month if you want. You can just Google days or whatever and do that, because I think that for me was a big thing, because not a lot of men or people know about testosterone. Always gets demonized, right? They don't know the importance of testosterone. So creating a day, now it's been like 4 years now, gives us a day for awareness. What is it? Why is it important? Why should we get it checked? What are the ways to naturally increase? So I highly recommend that you do that. I think that with the book that you have and the information, and I do appreciate everything you talked about today. Like I said, it's close to my heart. I'm watching it right now. And, and again, it always sparked. It's so funny because last time I was at my parents' house, I went downstairs in the basement, and the first book I saw was Vascular Dementia from when I was in school. And I had a book I had to read Vascular Dementia for school back in the day. And it was just like, and I think that's exactly what Uncle David has, is vascular dementia plus whatever else comes with that. So, I think that this is incredible. Thank you so much for being on here. Any last words for the listeners or people watching this?
I do. And this is a phrase that we use a lot, which is stop being a dementia worrier. Start becoming a prevention warrior. This is an active process. It's not going to happen by luck or chance. It's going to happen by doing things in an active way. So, get out there. And I think that's very much in keeping with your message about doing things as well.
Yeah, it's all about action, man. This is the talk is cheap. We gotta be active. Thank you so much, Dr. Cleonski. I appreciate you, and I'm sure we'll talk again at some point in the future.
So.
And thank you so much for being here.
Thank you.